Dr. McMahon, psychiatrist and research in genetics, has been leading us through a discussion of the various aspects of mood disorders and anxiety in relation to genetics. Dr. McMahon, what age do these illnesses or disorders appear? Is there a typical age range?
These kinds of illnesses can actually occur at any age, but they're more common during adolescence and early adulthood. Clinical depression has a second peak late in life, particularly after the age of 60. And that might reflect some changes that occur as the brain ages. But the anxiety disorders and bipolar disorder tend to begin either in late adolescence or early adulthood.
Dr. McMahon, would you please give us an example of a hopeful story to encourage our viewers?
Yes, well, many people who grow up in a family where several of their relatives have suffered from a mental illness feel that they might be inevitable to develop the illness themselves, that somehow it's a guaranteed event. But as I've mentioned earlier, most of the time these kinds of illnesses, while they run in families, skip generations and skip individuals within a generation, so that many people, even if they have a strong family history of depression, bipolar disorder, or schizophrenia, will escape developing the illness themselves. This is actually one of the great mysteries in the field right now, is to understand why that is. It may have something to do with the way in which genetic risk factors move across a family, but it probably also has a lot to do with individual characteristics, resilience, and the ability of different people to navigate life's challenges. An example of that, a patient who participates in our study has a very strong family history of bipolar disorder. Her mother developed the illness early in life and has been hospitalized many times. Her brother actually died of suicide, probably as a result of bipolar disorder. And when she volunteered for our study, she was mainly concerned about whether she would develop the illness herself or whether she would pass it on to her children. When we evaluated her in the study, we found that she had not developed any signs of the illness, even though she was already in her 50s. And we were able to reassure her that she had likely gone beyond the age at which she was going to be at a great risk for the illness herself. And that meant that her children also were probably at lower risk than she was concerned they were. So again, the story is genes are not fate, but they do influence the probabilities, and that can be very helpful for individuals who feel that they may be at risk. They should let their doctors know when there's a family history of the illness. That way, the doctor can be more ready to respond and to recognize the illness if it does occur.
Would you give us personal details how you got interested in the field of genetic psychiatry?
Yes, when I was doing my medical training in Baltimore, I actually encountered a patient who was admitted to the hospital after a suicide attempt. And while I assisted with her care, I learned about her family and how the illness had run, again, through several generations. I was also struck by how the illness would come out of the blue and strike her sometimes after months or years of being perfectly well. She did well in the hospital and was able to resume her regular life, taking lithium. But I was very puzzled after that encounter to understand why it was that this illness was so strongly familial, and how it was that it could lie dormant for months or years at a time, only to come out in the most severe way. And also, I was very puzzled how a drug as simple as lithium, which is really just a salt, could be so effective in treating and preventing the illness in many people. I also was fortunate to come into the medical field at the time when the new genetics was becoming a new possibility. the kinds of technologies I've mentioned today, genetic markers, sequencing, ways in which we can measure gene expression, all of this was only becoming possible as I was entering the medical field. So it actually was a good time for someone like myself to go into this field of research, because we finally had the tools we needed to make progress. And although the progress has been slow at times, it's been getting faster in recent years. And so it's a very exciting time, actually, to be studying the genetics of psychiatric illnesses, because I'm really very hopeful that we'll, through the understanding that we get from genetic tools, we'll be able to better diagnose and treat these conditions in the near future.